Assalamu
alaikum.
Can everyone see my screen?
Yep, I can see it.
Okay, I think we'll start now. So we've got all the speakers here. So Assalamu alaikum wa rahmatullahi wa barakatuhu, brothers and sisters, and good afternoon, ladies and gentlemen. Thank you for all attending today's event. It was on the backdrop that obviously we're in this huge pandemic, and specifically in our borough and across the country with the increase in the number of rates, and since the announcement of the vaccine, there have been thousands of questions online, and most likely most of us have been having debates with our families about the vaccine and its efficacy and whether to take it and what have you. I think really what sparked the need for this event in particular for us to organize was that there was a particular concern that amongst the Black, Asian and minority communities, that there were some parents or the elderly people within our community were either not taking the vaccine or were being strongly discouraged from taking it because of encouragement or discouragement, however you want to see it, from their children or from their family. So personally, that was the motivation for myself to try and get this organized. So we have a panel of experts to discuss all the different types of questions submitted by people from the Redbridge community. And most likely you've all come across these questions before, but I thought, we thought this would be a good chance to get a good panel together to present to parents from the area. So just to go through the quick agenda. So the first will be a short introduction from all the panelists. Like I said, what we've done is we've grouped all the questions into 4 areas. So the first will be around the vaccine. The second will be around the COVID-19 strategy that's been implemented in the UK. The reality of COVID, so some of the questions about the facts around the ability of its infection rates and these type of things. And then there are some wider questions about schooling and what it says about our society so far, how our society in the UK has sort of been affected by Corona. So those are the 4 groups of questions that I have. And all the questions were submitted in advance, so we won't be taking any questions during the event unless we go through all of them, which I'll be surprised if we manage to do. And we'll be finishing at 5 p.m. hopefully. So just to introduce our panel, and if each of our panel could just say a few words about themselves. So our first panelist is Dr. Mostafa Hasib, a local GP. Dr. Mostafa, do you mind just saying a few words about your background?
Yes, assalamu alaikum to everyone here, and again, thanks for inviting me onto this discussion forum. I'm a GP by profession. I live locally. I actually work on the other side of the North Circle in Newham, mainly. I'm also a khatib. I've been a khatib at Whipps Cross Hospital for over 20 years, and I'm also a local sort of activist as well. And I think for me, being in the profession, but also being as a khatib and interacting with both the hospital settings, so I lead the Jummah Salah at Whipps Cross Hospital, gives me an insight into what's happening in the hospitals, but also the concerns of our local community. So that's me.
Gladys, please.
Hello, thank you for inviting me. I'm Gladys Xavier. I'm your Director of Public Health for Redbridge. So I started my life as a nurse, and then I went on to become a clinical epidemiologist. So I'm a consultant in public health. So my role is making sure the whole of Redbridge, so it's population health. So when it comes to, I will actually give you a brief overview later on about the current situation in Redbridge. And as I said, I'm also a resident of Redbridge, and I'm so privileged to serve the people of Redbridge. So I'm really thank you for inviting me.
No problem, thank you. Moulana Farooq, assalamu alaikum.
Wa alaikum salam wa rahmatullahi wa barakatuh. I'm Farooq Sulaiman, and I am a qualified secondary school teacher and I work in a local state secondary school. And alongside that, I am serving as an Imam as well at the local Masjid in Ilford, Masjid Al-Falah. So inshallah, I can help today with queries regarding schooling at home, etc. Inshallah. Jazakallah.
Last but not least, Dr. Mohammed Akhtar. Assalamu alaikum. You're on mute, brother.
One day I'll get a hang of the Zoom. So my name is Mohammed Akhtar. I'm a cardiology registrar in Barts Health. I went to medical school at Barts in London School of Medicine and Dentistry. I've been living locally in East London for at least 25 years now. Yeah, I've done all my training in East London, so I'm local to the community.
I actually just forgot to do a quick introduction of all the organizers for today's event from the Redbridge Muslim Parents Association. So firstly, I actually forgot to introduce myself to everyone. So my name's Ghulam. I'm a local parent in Redbridge. I'm from Goodmays. I work in a pharmaceutical company that helped develop the vaccine, but I work in genetics, in genetic research primarily. And I'm also starting I've just started last year a master's in epidemiology. That's what I've been doing in terms of project work for the past 4 years. So I hope to be qualified within the next years, hopefully. Can I introduce Brother Ammar, please? I think he's there. If you can give a short intro, please, Ammar.
Yeah, of course. Assalamu alaikum. First of all, I want to thank all the panelists for taking time out of their busy schedules. I know we're all busy. And
Ammar, your internet is okay. Your audio is cracking, I think, for me. Jamil, are you there? Are you able to do? Ammar, your internet, your audio is crackling. Your audio is not coming.
What I'll do? Let me. Is that better?
Yeah, better. Yeah.
Is that better? I'll switch off my camera because maybe it's a bandwidth issue. I do apologize for that. I've got the part here.
That's okay, Ammar. Ammar, we'll move on to
the fact that there's lots.
Jamil, are you able to introduce yourself, please?
Yes, hello and assalamu alaikum, everyone. My name's Jamil. I've been in Redbridge for about 7 years now. Proud father of 4 parents. 4 children. I work locally as well. I'm a manager at the local bus garage. And Jazakallah khair, and thank you very much, everyone, for coming online today.
Thank you. And Mubin, are you there?
Assalamu alaikum. Can you hear me?
Yeah.
Okay, assalamu alaikum. My name is Mubin. I've been a resident at Redbridge for about coming up to 4 years. Previously, I was at Waltham Forest. I'm like Jamil, I'm a proud father of 4 young kids. And professionally, I work as a quantitative analyst in Barclays Investment Bank. But as a father of 4 young kids, I appreciate the importance of parenting, given in the climate we live in. So I thank all the panelists for coming on today and providing their feedback and experience. Thank you.
Okay, if we go to the first section, the way we'll do it is I'll throw out the questions, and then any panelist that wants to answer can go for it. So the first question that was submitted in advance was, can we trust Big Pharma? Who would like to take on this question? Gladys, okay.
Okay, thank you. So I have now worked in public health for a number of years. I used to work for the Health Protection Agency, which is now Public Health England. So pharma companies, I know where people do get a little bit cautious, but there's strict regulations about how they manufacture, how they promote vaccines. So for us in this country, we have got a fantastic process, how it's all done. So I think, you know, sometimes it's very easy to say they're not there to make money. In this pandemic, they're not there to make money. The whole purpose of these pharma companies, remember, pharma companies can't function without qualified epidemiologists, virologists, statisticians, and all other people. So they wouldn't put their reputation online. They are big pharma companies. So I personally, I mean, you do have to trust, because we can't do it ourselves.
Yeah, thank you. Dr. Riz, do you have a comment on this?
So this is one of the questions that back, I remember last November, I was surprised and intrigued by the sort of the discussions that were happening in our community about the uptake of the vaccine. And I came across quite a lot of people who were saying, look, I don't want to take this. And initially I was shocked and a bit surprised. And so I tried to investigate, again, as a role of both from the professional front and from the Islamic front, trying to get to the bottom of what is it that people were worried about. And this is one of the things that came up. And I think it's very important that we sometimes appreciate what the concerns of the community are. Otherwise, we're almost seen as not being part of that and not understanding. So I think the key concern of Big Pharma is, of course, the history, the track record of some of these big pharmaceutical companies. When I talked to people, they were sort of describing some of the issues with some of the less than ethical policies that were taken by Big Pharma in the past. And I think that's obviously, it leaves a bad taste in a lot of people's mouths, and people sort of think, okay, can we trust them this time around? And again, I think, you know, we can't deny that fact of history. We have to accept that. Pharmaceutical companies at the end of the day are there to make money. We'd like to think that these companies are there to help. That's the value, it's a humanitarian value that they should be seeking. But unfortunately, historically, that's what we've seen. Having said that, you know, I agree with Gladys here. In this particular case, I think Big Pharma has a lot to invest and a lot to put in. I think things are a little bit different, because unlike previously where Big Pharma was sort of looking at, you know, what to do in order to get a profit at the end, here with such a global pandemic, a lot of money has been invested by governments, and which might explain why things have been so rapid. A lot of input has been given by the regulatory authorities, and they work closely together with Big Pharma. And so I think, and in this case, I think I personally am not so worried about any of the concerns about trust of Big Pharma in terms of the vaccination program for COVID.
The next question is, why should people take the vaccine when it has a high survival rate, recovery of 99.96% if you're under 60 years old? Who would like to take this question?
I can
Okay.
actually address that question. So just to kind of touch on the Big Pharma point, I think, because this will blend in, I think it's important for us as healthcare professionals and members of the healthcare community to emphasize the importance of nuance. You can have concerns about quote unquote Big Pharma, particularly about some of the mistakes that have been made in the past. You can have concerns about a quote unquote lack of long-term data with regards to vaccines. And yet you can also get vaccinated. These two are not, or two or three are not mutually exclusive. And the same pharmaceutical companies which are producing the vaccines are also responsible for a lot of the medications which individuals take from a day-to-day basis, whether it's with regards to their blood pressure or their heart problems or diabetes, so on and so on and so on. So while we're not advocating for 100% trust in the pharmaceutical industry, I don't think anyone would advise that. What we are advocating for is reasonable trust based on the experiences and the data that we have. With regards to why should people take the vaccine if, you know, supposedly the survival rate amongst those who are of a younger age is so great, this statement is false. So this is a 99.96% is a made-up statistic. Whilst we know that those who are older and those who are from a male background and those who are from Black, Asian, and minority ethnic communities have a significantly higher risk from COVID mortality, if you just take those from who are less than 60 or even less than 50, between these ages of 25 to 50, their mortality is not insignificant. There was a study performed in the Journal of the American Medical Association which found that COVID-19 was responsible for an excess of 18% above and beyond what the expected mortality would be if COVID-19 was not there in those from the ages of 25 to 50. We know that COVID-19 and this is based on the American data, but it's reasonably generalizable to the UK community, but COVID-19 was responsible for 35% of the deaths within the youth, higher than those seen with the opioid pandemic that took place earlier amongst the youth. So the mortality rate associated with the youth is not insignificant. And I'm not sure if we'll cover this later, but this is also a kind of misunderstanding that, well, if I somehow survive, I'll be fine. Because if you somehow survive COVID-19, then you have to contend with long COVID, this kind of constellation of symptoms, which may involve having to live with heart failure for the rest of your life, having to live with chronic kidney disease for the rest of your life, having to live with clots in your lung for the rest of your life. These are not insignificant diseases if you somehow survive COVID-19. So that's essentially what we would say, or what I would say in response to that.
Thank you. If there are any of the panelists who would like to add an answer, just feel free to jump in. Go for it.
Can I just come into that, Mohammed's point? So he's absolutely right about the evidence. So I also want to then bring it back to Redbridge.
Okay.
So I get the data for Redbridge every week. And he's absolutely right. It is same thing in Redbridge. So he's quite right. That is not right. That is not correct. So I really want to confirm that.
So is it it's not having a disproportionate effect on the elderly, it's having a sort of equal or generally the same effect,
is affecting,
regardless of age?
If you look at across London, the evidence in London of hospitals and also our local BHRUT and Bath's data. So it really doesn't mean, I think it's the long COVID is something, the long-term impact of COVID is quite concerning for all of us. So I think it's absolutely right to confirm that.
Thank you.
If I can add something.
Moulana.
So the experience on the ground from the general practice side. So absolutely, this wave that we're going through at the moment, there hasn't been a single day that I've been at work where I haven't come across patients, usually of sort of Asian backgrounds, BAME backgrounds, who are in their 40s and 50s actually. We're dishing out SATS monitors to these patients, getting calls, every couple of days, making calls and seeing how they're doing. And a lot of people are suffering. The other thing is, and deaths are occurring as well. I mean, every day I also have to take calls about someone who's died and then take that person through the grieving process, the relatives through the grieving process, and be part of that. And as someone who has survived, as Mohammed said, survived COVID myself back in March, April, I was out of the picture for 2 months, and I think this is an important point, the long COVID part of it, which we're still sort of coming to grips with and understanding, is a significant issue. I mean, I'm 10 months, 11 months post-COVID, and I'm still not 100%. So there's certainly something to think about that.
Thank you. Can you choose which vaccine to have? And what if you reject the one they give you as it may not be suitable due to the allergies? Can you then ask for a different vaccine? Who would like to take this question?
If I start, and
Gladys,
I'm sure my colleagues will have a lot more to add.
Yeah.
So we, as a local authority in public health, as a director of public health, work with the NHS. So we got what we call primary care networks who are leading on, it's across the nation anyway, it's not just us, of delivering the vaccine. So you can't actually choose what you can have. So I think we must have faith in the vaccine because they've all gone through trials. And what, obviously, Pfizer came on board first, and now we got the Oxford vaccine. So it's the allergy issue that always comes on board. So when you go for it's about anaphylactic rather than just any allergy. I'm allergic to penicillin, but I still have the vaccine. So it's not just about, but you would have that word with your clinician rather than not. So for me, I think you can't choose what you can mix that. There are about 13 phase 3 trials going on at the moment, and there will be more coming on board. But at the moment, you cannot choose what you want. You just go with what is there, and they're all effective.
So what are there any allergies that someone may have that would result in them not being able to take any of the vaccines, or specifically or the AstraZeneca one or the Pfizer one? Gladys, do you know?
I'll leave that to my colleagues. I think
Okay.
the recommendation is if you have had an anaphylactic shock, then
Okay.
if you got to, that's a different, you would have that conversation with your doctor.
GP. Okay, fair enough.
So if I can add to that.
Yeah.
So essentially, again, I'm not quite sure about what's happening in Redbridge, but in Newham, it's similar. You don't get a choice. However, when you sign up, you will be told what vaccine is going to be given. So I had the Pfizer vaccine a month or so ago. The patients at the moment in some of the vaccination centres are, I think it's the AZ vaccine at the moment, the AstraZeneca one. So you'll know which one you'll be getting. The key thing about allergies is that, yes, there was that initial sort of concern about someone having a reaction to an anaphylaxis, and then we found that they were people who already had sort of severe reactions. So the initial sort of advice from the regulatory authority was, look, anyone who's got a history of allergy shouldn't take it. That has actually changed a little bit now. So what they're saying is that if you are allergic to any of the components which are in any of these vaccines, so when you go to have that vaccination, of course, they will go through that with you. If you're allergic to any of those and have an anaphylactic reaction to that, then you shouldn't have those. That vaccine. But as I said, there are now alternatives. So you've got the Moderna one, the Pfizer one, and the AZ one. So I think we will be able to manage some of these things.
Is it obligatory from an Islamic point of view to take the vaccine? Who would like to take this on? Maybe Moulana Farooq, if you haven't had a chance to get involved yet.
So from an Islamic point of view, a lot of the scholars have done some research, and many of them are saying, yeah, it's permissible to take the vaccine. There are no animal components in the vaccine. I think the Oxford AstraZeneca one has a very minimal amount of alcohol, but this is very negligible. And that's permissible to take. So in terms of the permissibility, the scholars are saying it's permissible to take the vaccine. But in terms of if it's obligatory on a person, then that depends on the certain individual, and depends on what the advice that their doctors give.
Thank you. Does anyone else want to add anything to this question?
Sorry, if I may again. This issue of obligatory was actually one of those issues that cropped up last November when I was talking to the community and people, because that was one of the big things that was being pushed, that this will be forced upon you and you must be, and that's why we need to resist and all of this sort of thing. And I'll be honest with you, that's not the case. The government at no point has said it's going to be forced upon anyone. And from an Islamic point of view, again, this is medicine, treatments. And our view, and this is, I think unanimous amongst the scholars, is that this seeking treatment is something which is recommended, but is not obligatory. And we know that because there was an example at the time of the Prophet, peace be upon him, where a woman who had epilepsy came to him seeking help, and he said, like, okay, I can make dua, I can make a prayer that this will go away. And she said, no, I'd rather keep my illness, but as long as I don't become uncovered. So from this we understand that it's not obligatory from Islam to seek treatment. The only thing I would say on this point though is that whilst it's not obligatory as an individual, we also have, as Muslims, we have a responsibility to those around us. And sometimes we need to balance that and think about, whilst, yes, it may not be something which is obligatory upon me to have, by doing so, am I going to be putting other people at risk? And that's something to think about.
Is the vaccine safe and halal?
I'm happy to talk about the safe part, and I think Dr. Mostafa and Moulana Farooq can talk about the halal part. As for safe, I think it's really important when it comes to vaccines to frame them correctly. Vaccines are not a new medication, and that is what vaccines are. They are essentially any other form of medication. Vaccines have been around for decades, whether it was the smallpox vaccine or the MMR vaccine. The data that we have on vaccine is extensive. It shows that vaccines generally are safe. They are held to a much higher standard than any other medication on the market, purely because they're given to individuals who are otherwise healthy. And so on the background of a lot of safety data for vaccines, we have our current vaccines, which are based on existing technologies. Even the mRNA technology is existing technology. It goes back at least 20 to 25 years. So it's based on existing technology. And then we have the data from the trials. And now we have real world data. And combining all of that together demonstrates that the vaccines are safe. Out of, and this is now probably a few days or a week old now, out of 23 million individuals, only 23 individuals who have been vaccinated, 23 individuals have had a severe allergic reaction, all of whom have survived, all of whom, the vast majority, were identified in that 15-minute window after being vaccinated. If you compare that to the antibiotic that your local GP prescribes you, there's no comparison. 1 in 2,000 individuals who receives the antibiotics that we go to our GP because I've got a cough, I've got a cold, give me some antibiotics. 1 in 2,000 individuals is potentially able to get a severe allergic reaction. So there are lots of myths around the vaccines, but in general, both the existing data and the current data suggests that the vaccines are safe. They don't have any adverse reactions with regards to infertility. There's no link towards fertility. There's no link towards any congenital or childhood illness disorders. And in terms of a theoretical link, in terms of adverse reactions, we can see they're overwhelmingly safe.
Thank you. Does anyone else want to add to this question?
I'll just repeat what I said earlier in terms of the vaccine is halal. I think it's been confirmed on the government website that there is no animal component in the two vaccines, the Pfizer one and the Oxford one, and therefore the vaccine is halal.
Thank you. Gladys.
No, I think that's what I was going to come in to say as well. So Farooq has confirmed it. Thank you.
Thank you. Thank you. If I have the vaccine, how protected am I in terms of getting COVID? And also in terms of social interactions if people don't abide by distancing rules? Gladys.
So can I come into that?
Yeah.
I think the vaccine is good news. However, I think we mustn't just see it as once we've had the vaccine, that we can go back to normal. So recent data, which was has been now published data, that I think it was the Oxford vaccine, which says that not only does it protect you from getting seriously ill, but also it stops you passing on to others. And I think the current modeling from Oxford suggests that, even Pfizer does suggest that. But it doesn't mean we need a lot more people immunized. So just because you've had the vaccine, you really cannot go back to the way you are. So if I look at Redbridge, I get data every single day on the case numbers, the rates. So at the moment, I mean, I just want to give you a bit of outlook about Redbridge. Now, 3 weeks ago, if you had invited me, I would have said to you, the case rate was about 1,700 per 100,000. Wow. Now that has come down to 300 per 100,000, which is still very high, but we've actually come down quite a lot. So when I get what I call spatial epidemiology, and a lot of the transmission happens within households. So it's actually people bringing it to people rather than in workplace health or other areas. So we really need to be careful. So it's regardless. I mean, I think what I would suggest, I'm sure my colleagues would, you would treat anyone you meet who are not in your bubble or in your household as if they have got COVID and you may have COVID. So you still continue to do that. So that's really, really important message. Just because you've had the vaccine doesn't mean you can just go and do what you like.
Thank you.
We just need to be patient.
Of course. How do you know that there will be no adverse long-term effects if the vaccine has only just been developed? And just to add to this, a number of people that and some of the other questions I didn't include, just the comment was specifically that people would refuse to take the vaccine until a year after most people have been vaccinated to see if there have been any adverse effects. I mean, see, Dr. Mohammed just mentioned the stat about 23 million have been vaccinated. I think he said 23 million, and maybe 15 people have had severe adverse effects. So why you would need to wait a year? I don't really understand that, but that's a point that's also been made. So if maybe you can, someone can respond to this question, please. Maybe Dr. Mohammed.
So I'm sure my colleagues will want to chime in this as well, but this idea, so I think there's two parts to this. One is, how has it been rapidly developed? And I think that's been extensively addressed in other arenas, but essentially to summarize, lots of funding, lack of red tape, lots of volunteers who have come forward to be part of the trials. And we have a pandemic which provides us the excellent opportunity to test the efficacy of these vaccines. All these reasons combined is why the vaccines have been developed as quickly as they have. There have been no shortcuts in terms of safety. It's just a combination of essentially the whole world working together on this. Now, with regards to the need for long-term data, I think this points to impossible expectations. As I mentioned, vaccines have excellent long-term data. These specific vaccines, we admit, we don't have as much data as we would like. We have imperfect data, but it's a question of making the best out of a bad situation. And in this situation, the bad situation is referring to COVID-19 pandemic. We have to ask ourselves, would you want to wait for an arbitrarily randomly picked number, a year, 2 years, 3 years, and trade that risk for the risk of contracting COVID-19 yourself and experiencing all the either mortality or long-term disease side effects that we know COVID-19 is associated with, and even potentially passing on to your family, your friends? It's a question of balancing the two. Do we wait to get years and years of data for the vaccines and let thousands and thousands and thousands of individuals die in the process? Of course, that doesn't sound sensible. And so the most sensible approach has been the one that has been adopted, which is get good short-term data based on, and we have the previous data for the vaccines. And then we will continue to monitor. No drug or medication is ever released into the community without it being monitored long-term. Every individual receives a vaccine who experiences a significant side effect or needs to go to the hospital is automatically noted by the MHRA, the Medication and Health Regulatory Agency. And so long-term, if we do identify any significant adverse effects, side effects, then of course those findings will be made available to the public, and we can make a decision based on that available data. But we have to make a decision based on the data we have at the moment. We can't afford to let so many individuals die or wait for an arbitrarily randomly picked number of days or months or years before we feel happy to take the medication. So if something does occur in the future, of course we'll pay attention to it, and we will adjust accordingly. But until then, the vaccines have been demonstrated to be safe, and we would advise to take it.
Thank you.
Can I also just come in on that?
Go for it.
So these are not live vaccines for a start. So studies are going across. This is a pandemic, so it's not just in the UK. I mean, there are so many studies. I mean, I get findings from studies every single day. So I think I really would like to sort of support what Mohammed just has said. I mean, we have the flu vaccine every single year. And I think sometimes, you know, this is a disease. If we don't vaccinate, then people will die. So I think we just need to, I think we also have to be honest. This is something new. There are lots of not known, but we also know a lot of knows. So I think we just have to go with the evidence.
Okay. Before we move on to the next section, we've got 3 questions, and I'll ask them all at the same time on the vaccine. So the first is, when will children be included in vaccine trials so that they can be vaccinated? The second is, my child is 15 and comes under extremely vulnerable group. Can he get the vaccine? My father passed away from receiving Pfizer vaccine. It was not due to a reaction, just that being he caught COVID. So how are these data being gathered? And the last point, I personally take the naturopathic approach rather than allopathic medicine, as it has a lot of side effects, whereas naturopathic is herbal, etc. So maybe Gladys again on the, or Dr. I don't know who would want to answer.
Okay, so sorry, I missed the first one. Question was about
when will children be vaccinated?
It's not licensed or under 16s at the moment.
Okay.
So I think somebody mentioned about someone who's having some underlying medical condition. I think that is a case by case with a conversation with their GP. So you can't generally just say. So I think it really depends, because the GP would know the case and the issues rather than, you know, so it's not, at the moment it's not licensed, because there are trials going on at the moment. So what was the third question?
My father passed away after receiving Pfizer vaccine. It was not due to reaction, just that being equal. How are these data being? Yeah,
so at the moment, if you go into hospital or, you know, the ONS data, I mean, I get the death data every week. So it says that, you know, so if you go into hospital with something else and they find that you are, you know, you have had COVID, that doesn't mean you died of COVID, because the likelihood is because COVID made it harder. So it could be end of life or underlying medical conditions. So we get that all the time. It's a very, very tricky situation, but we just have to go with that. That's the way we now look at data, death data.
Yeah.
Sorry, and the last one?
I personally take the naturopathic approach rather than allopathic medicine, as it has a lot of side effects.
As a director of public health and a clinician, I would say I would always go for evidence-based. So because we have got the evidence of what works, and I really do not have evidence about what the natural remedies. I'm sure my colleagues would have comment on that.
Okay. In terms of the question about the person's father passing away, it was after receiving the Pfizer vaccine. So that data is being recorded where, or is it being recorded somewhere?
I mean, you will have that, but it probably doesn't mean they died because of the vaccine, probably underlying conditions. So we will have that again. That's a lot more data to, so, you know, we do have to, this is something new, and we, you know, we'll have to look at that. But I very much doubt it's because of the vaccine.
Okay. So next.
Sorry, can I just add to that?
Okay.
So again, I mean, we know that straight after having the vaccine, you're not immune. Just because you've had the vaccine, the body needs time to produce the antibodies. And then again, it's not 100%. We also know that. So in that period, you can catch COVID and then succumb to its effects. So that's something to think about, and goes back to that earlier point about still maintaining social distance and all of those measures. I think the other thing is, and Gladys has mentioned this, and it goes back to the earlier point about concerns about long-term effects. Look, this the way I see it is that this is a new virus. We're still learning about it. We're still learning about the vaccine as well. But the evidence suggests that it's very safe. But the other thing is that it's when we look at these vaccines, how much, what is it that can go wrong? I mean, all of these things are being really closely monitored. Even when we look at those first allergies that occurred, it was headline news, wasn't it? Nothing was kept hidden or secret. I think that should help to reassure us a little bit that, look, all of these things are actually being monitored. And if you have, and everyone who has the vaccination, they're given part of the yellow card system, you'll be given a booklet and all the rest of it. And if any, and they say that if you have any side effect, just report it. And so that we can build up the evidence for this, and nothing's really being kept hidden here. So I think that's reassurance that this vaccine has been looked at very closely and its side effects.
Thank you. We're just going to move on to the next session. Now we're discussing the COVID-19 strategy. So first question, is the PCR test flawed? I think there have been a number of questions. I mean, the general question, and I just reduced it to this, is a lot of questions are about whether there were lots of false positives and false negatives. And so we just framed it as, is the PCR test really flawed?
Okay. So can I come into that? The PCR test is considered the gold standard.
Okay.
Because that test, it's got to go to the lab to be confirmed. So what we also have, what we call the LFD, the lateral flow device testing, which is recommended in Redbridge. So now we recommend the LFD testing for, there are 17 million people in the UK who cannot, the general message is, if you can work from home, you work from home. But there are a lot of people like us, we have to go to work because we are frontline. So what we say is then you get yourself 2 tests a week, which is called lateral flow device testing. And then if you do test positive, because in Redbridge and our neighbouring boroughs, the prevalence has been so high, they even recommend that you don't actually go for a PCR test. So if you do test positive, then you self-isolate and your contacts. So that's about the breaking the chain of infection. But as the prevalence comes down, that will then go on to PCR. So for me, PCR is the gold standard. And also once you get into the PCR system, then also generates the test and trace system. So we have got those in place. I know, I wouldn't say PCR test is flawed, but a lot of trials have been done on quite a lot of LFD tests. And what we have in place is really the most, I think what we shouldn't really say is the LFD testing, that's not only the kit in the basket. We need a lot more other things. And that is one of the things we have to help towards the pandemic. So we are also now so we'll be, it's going to be for schools, I know there was somebody here who's from a school, I think for primary school, for early years testing. So we do have to continue with the testing regime.
So why are there false positives and false negatives with the PCR test?
I wouldn't say that about the PCR. I think that was more about the LFDs. I think at the beginning, again, these are evolving. Remember, as I keep saying to you, as the disease evolves, we'll also get a new diagnostic. And as we come on, sometimes you have to put your trust into something.
Thank you, The next question. I know many people who have passed away recently from reasons other than COVID, but yet the death certificate states COVID as the reason for death. Please, can you explain why this is? Again, a number of questions are grouped into one. The main concern was about the reason why there are high death numbers is because a lot of deaths are being grouped into COVID, and that some of the reasons given or submitted in advance were that it was by coroners who advised that in order to speed up the burial process or whatever, then put COVID and then it will get sort of zipped through. Who would like to take this on?
I'm happy to just mention a few points, and then I'm sure my colleagues will address the rest of the question. But I think a key, because essentially what this question is suggesting or some of the other questions, that there's some kind of conspiracy in terms of how COVID is being sold to the public. And because otherwise, I mean, whoever's asking this question, I'll just ask them, how do they know that so-and-so has died from other reasons? I mean, you know, how can they possibly know this information without being a medical professional? And so in the likely answer that they can't, this just reflects a general distrust about the way COVID is being sold to the community. And whilst I appreciate that certain things are new, lockdown is new for us. You know, we haven't experienced this as a community for decades. Maybe before this was a Second World War. So what I would emphasize to the members of the general public is to trust their messengers, trust the doctors that they go to, their GP, their local Imam, their local healthcare providers, the members of the local council, you know, individuals like Gladys, Dr. Mostafa Hasib, Moulana Farooq. Trust these individuals when they say that COVID is serious, it can cause a life-threatening illness, and it can cause a significant impact on their life if they somehow do survive this illness. Because there's no possible way. I mean, we know, as the evidence states, that COVID has a significant impact on every other disease or condition that you may have: diabetes, heart problems, whatever it is, blood pressure. It will exacerbate all of them. It will increase your chances of dying if you have any of these other conditions. And so chances are, if someone, if someone has died in a hospital and the cause of death is COVID, that's the cause of death. That's what, if they didn't have COVID, they probably wouldn't have died. It's as simple as that. But I think to address the underlying concern, there is some distrust. And what we would push back and say, trust the members of the community who generally have not led you wrong so far. You go to them for your kidney problems, your chesty coughs, your marital issues, and et cetera, et cetera, et cetera. Trust them when they say that this is an important illness to take seriously, and that we are trying to do everything we possibly can in their best interests. This is not some kind of global cover-up. That's totally impractical. That would say billions or millions of doctors and healthcare professionals and imams are in concert working together to achieve what exactly? We're acting in this way because we can see from our own eyes that this is a serious health condition, and we want to save our community. That's the only reason why we're saying what we're saying.
Thank you.
Can I add something to that?
Okay.
I would really echo what Dr. Mohammed has just said. Look, I had COVID back in March. There was all this initial thing about, okay, it's just a glorified form of flu. And I've had flu and I've had COVID, and COVID was nothing like flu. So that's one aspect. It's also what we're seeing on the ground. I mean, in general practice, in our surgeries previously, where we would see maybe 1 or 2 deaths a month, we're now seeing 8 to 10 deaths a month. What we're seeing is, I'm a khatib at Whipscott Hospital, so every Friday I get to meet the consultants there in Jummah. I was speaking to an A&E consultant for last Friday, and I was just asking him, what's the state of affairs? And he said, look, I have never experienced anything like this in my life, in my working life. We had 1 week where we were seeing patients in the ambulances outside. So there's no space in the hospital. We're seeing them outside. The wards, I mean, you speak to the nursing staff, you speak to the porters, they're all saying one thing, that we have not seen anything like this on the wards. So this notion, and I think goes back to what Dr. Mohammed is saying, is that there is this sort of this thought that, oh, this doesn't exist or it's not real. I think some of that is changing because this second wave is hitting our community particularly hard. And a lot of the people who thought, okay, it's not really anything, are now being affected directly or seeing their family being affected. This is something. It is something. The scale of which, you can say that it's this or that and the government's doing this. And absolutely, there's this trust issue, and that's the sad thing about all of this, is that unfortunately trust in government is been depleted because of some of what they've done. But having said that, as Dr. Mohammed said, is that we need to put our trust somewhere, and there's no reason for us to make any of this up. I think the other thing is that, oh, there's some grand conspiracy, and we say, look, oh, Big Pharma's making money, these people are making money, those people are making money. And I'll just give a simple example. You know, my local grocer, you know, he's done very well from this pandemic. So is he responsible? Is he the one, the global mastermind who's and all the grocers who've come together to orchestrate this? Of course not. That would be silly for us to say so. There will be people, when some of these things happen, there will be people who will do well, and there'll be lots of people who don't do well. But to say that there's some sort of other conspiracy, I think is a bit far-fetched without evidence.
The next question is why did...
So, Ghulam, can I just come back with some facts for Redbridge now?
Yeah.
So, since the pandemic started, we have had 30,000 cases reported, and we have had 620 deaths, COVID-related. And I have lived in this borough for 35 years. We are a rich and diverse borough, and it's sadly most of them are from our own communities. So we really need to take it seriously. So one of the reasons is, again, underlying medical conditions. So I don't know, many of you know, every director of public health has got to produce an annual public health report every year. And this year I have produced a report on impact of COVID, short term and long term. So we really need to be thinking. I know it's not just about health impact, it's also other, I think my colleague was talking about, it's about unemployment. You know, people are affected. There are people on furlough. So, you know, like parents, I've got grown up children now, so I don't have to do homeschooling, which I'm so glad about. But I'm sure, you know, my colleagues, I do know it's really, really hard. And also mental well-being for people. So there is going to be a lot of the short, you know, the short term, we will deal with it because we're a resilient borough. We are as a nation, and also borough, you know, we're a very, very rich and diverse community in Redbridge. We will spring up, but we also have to because there will be people, it will affect them a lot more than just the health issues. So we need to bear that in mind.
Thank you. I'll ask the next three questions all together, and whoever wants to get involved, please do. Why does Britain have one of the highest death rates in the world? Do you trust the government to handle this pandemic correctly? And why did the minority community have a high incidence of COVID? I'm just looking at the time. We have about 35 minutes left and 2 more sections to go. So if I can just ask the panelists to be as to the point as possible, please.
I'll try. I don't think I have much to say about the other sections, but with regards to, very quickly, do you trust the government to handle the pandemic correctly? My trust is not so much in the government. My trust is more in my colleagues in the healthcare profession. And the government is acting on advice from the healthcare profession. Now, whether the government chooses to listen to our advice or not, that's their problem. It's not my problem. I can disagree with some of their policies, but we are here to advocate on behalf of the healthcare professions and the Muslim medical community as the British Islamic Medical Association, and I'm sure my other colleagues are as well. So do you trust the government? In short, I'm not here to speak on their behalf. They can speak on their behalf, but from our side, we trust the data we have and we trust our colleagues. Why do the minority community have a higher incidence of COVID-19? I think this is very important. As a British Islamic Medical Association, we've been addressing this point extensively with other organizations. In summary, there was a study that was done about 1.4 million individuals looking at their electronic health records, looking at why they had a higher mortality rate from COVID, why ethnic minorities, Black, Asian, ethnic minorities had a higher mortality rate than those who were not. And they found that, number one, there was a significantly higher health impact with individuals from a Black, Asian, and ethnic minority background. So just to give an example, if you are a 40-year-old Asian gentleman, you have the same health impact as someone who is a 60-year-old Caucasian. So that's number one. Number two, they found that individuals from a Black, Asian, and minority ethnic background experience worse treatment when they engage with, for example, primary care services, receive insufficient housing support, social support. So this in general reflects what many ethnic minorities are frustrated about, which is that there are underlying inequalities with regards to the Black, Asian, and ethnic minority communities. There's no doubt about it. COVID-19 is a health crisis within a bigger health crisis of health inequalities and lack of engagement with the Black, Asian, and ethnic minority communities. So we have to address the current inequalities, but once COVID is over, we have to continue to address those inequalities. So why do the minority community have a high incidence of COVID-19? Number one, we would say that it's due to the health inequalities that already exist in our healthcare system, whether that's due to discrimination, lack of engagement, lack of funding, et cetera, et cetera. Number two, that may be due to the higher incidence of diseases within the minority community, which are susceptible to having a higher COVID-19 mortality, such as diabetes, high blood pressure. And then lastly, I would really want to push on this point. Much has been made about the fact that Black, Asian, and minority ethnic communities are not taking up the vaccine, and figures like 30% are quoted with regards to the uptake of the vaccine. We really need to push back against this. We as a British Islamic Medical Association have actually done our own survey of around 500 individuals. It's unpublished data so far, but we have found that between 70 to 80% of individuals from a Black, Asian, ethnic minority community are willing to take the vaccine. They do think that it is safe. So this idea that myths are rampant through our community and that everyone is essentially refusing to take the vaccine is false. Yes, there are some myths that are prevalent within our community, and we should address them. But the majority of our communities seem to think that the vaccine is safe, and that they seem to indicate that the vaccine is something that they'll be willing to take. That's essentially the point I want to emphasize, because I think this lack of uptake within the minority ethnic community may be a reason why some individuals may say, which we've argued against, why ethnic minority communities should not be prioritized for the vaccine. And we would strongly advise that they should be prioritized for the vaccine. We are a much higher mortality risk and morbidity risk from COVID-19. We deserve to be prioritized. Essentially, that's what I would say.
Do the other panelists have any comments?
So can I really am glad sort of Mohammed has brought that point, because I'm actually working with my team about, it is not, I think you're right, it's about vaccine hesitancy rather than just targeting BIMA, because we also did something similar. And we found that it's not that, it's really because a lot of people who are hesitant are the younger group, regardless of they're white or from a Black or ethnic minority group, who really is the social media. I think that is where they keep, because obviously, I mean, I'm older, but they seem to be thinking about that. So I think we need to also look at how we evolve and just not pigeonhole everyone.
Thank you. Dr. Rizwan or Moulana Farooq, do you have any comments on these questions?
I can have a crack at the first one. Why does Britain have one of the highest death rates in the world? I think one thing to understand is that, look, the sort of plague or sort of pandemic situation, it's going to be difficult for anyone to deal with. If you look at our history, Islamic history, we'll find some massive loss of life in some of the plagues that were historically present. But I think there's, I think, you know, we sort of can see this, is that one is about what the government is doing. One of it is the ideas and values that society holds. One of it is, you know, what the ideas that general people hold. Part of it is also, for instance, the state of the healthcare system and whether it can cope with this. And we know that the healthcare system has suffered over the last 10, 15 years with underfunding. The other is, as Dr. Mohammed was talking about, was the state of the general health of our society, which with all the inequalities isn't great. It isn't great. So I think there are a number of different factors, but sort of mishandling perhaps by the government, and I think also an issue of the values held in society. When people think that we are free and we, as individuals, we can do what we want and don't hold responsibility. That's one of the big things that you hear in the community. Some of the raves that go on, and people not wearing masks and having arguments about wearing masks and just not caring. It's very difficult to control these sort of things. And if you compare it with us listening to a program the other day about what's happening in Taiwan and Vietnam and all these countries, they have a very different setup, both from the population who are quite listening to their governments, and the governments who obviously have had dealt with SARS and all some of these conditions, who took a different approach of quickly sort of closing the borders and then test and trace mechanisms. But that's a different discussion.
Move on.
Can I just finish up, just to say to people, you will always hear all the negative things, but and the information, I mean, even as professionals, as a professional, I find it really, when I watch the news, there's so much information coming on. I would say to people, look at what is really relevant and just, for people who live in Redbridge, go to the website. We make sure that all the relevant information on the website for people to understand and make up their own mind.
Thank you. We'll go to the next section. Did more people die in 2019 with the flu compared to COVID-19 in other years? I think it's been worded a bit out here, actually. So did more people die in 2019 with the flu compared to death with COVID-19 in last year, 2020?
So can I just comment it? I'm sure my colleagues would know. Looking at the data for last year for flu, it wasn't anything more than what it was. What we call is excess deaths. So flu time, you would always. So one of the reasons why we promote the flu every single year. So people do die of flu. I think people forget that, but just that particular question you can't answer, because the flu season is not. That goes on till March this year.
Thank you. If you get COVID, how long do the antibodies protect you for? And are you likely to get it again because your immune system is weaker?
Can I just come in there again?
Yeah.
There are studies going on. I think the REACT and, there are a couple of studies that are going on. I think that it's been going on for 5 years. 5 months. It says there is antibodies up to 5 months, but at the same time, I think that, again, as I keep saying to you, this is a new virus, new disease. So there's a lot of things we don't know. So I think that advice is, regardless of whether you had it or not, you still have your vaccination.
Thank you. Can a person who has corona still pass on the infection to others if they now think it's okay to mix? Who would like to take this on?
If I just start that, if you have coronavirus, if you're diagnosed, then you must self-isolate, and also your contacts, because you can pass it on to others. So I think I've had various, we've got the test and trace, because we have got a local contact tracing service as well. People think once they are diagnosed, because we are also doing asymptomatic testing. So if you test positive, people think, oh yeah, I feel okay, so I will go out. But what you've got to remember is you may not feel unwell, but you can pass it on to other people. So if you're told you've got coronavirus, then please self-isolate for that 10-day period to break the chain of infection.
And then how about after isolation? Once you've come out of isolation,
isolation, that's fine. But that's why to break the chain of infection.
Yeah. And this is our final section, so some wider questions. So this is a submitted question in advance. Is COVID-19 not a punishment from God because we didn't speak out against what happened in Kashmir or to the Uyghurs? Who would like to take this on?
If I can come in here, inshallah.
Inshallah.
Yeah, so I mean, the reality of what Allah has intended through COVID, we don't know. That's the true answer. The wisdom and the hikmah of Allah subhanahu wa ta'ala, we do not know. But as some of the scholars say, that every blessing which does not draw us closer to God is in fact a calamity. And every calamity which draws us closer to God is in fact a blessing in disguise. We are going through a challenging time, and of course COVID, it's an illness, is a challenging time. But in our tradition, we shouldn't.
I think your internet is
We
cutting
shouldn't
up.
condition of Sahih.
Is Moulana Farooq, I think your internet is cracking up. Is that Dr. Rizwan? Do you want to add anything to this question?
I think I got the gist of what the Moulana was saying, and I agree that, look, from the Islamic perspective, these sort of events that befall us, is it a punishment? Is it a reminder? Is it a test? We don't know. But we act according to what we do know, and that is that what does Allah want us to do in this given situation? And I think that's the key thing. Our response needs to be according to what Allah wants us to do, and not what He doesn't want us to do.
Thank you. How can belief in a creator help people tackle this rough situation? Can you respond to this as well, please?
Yeah, having had COVID myself earlier this year and really being unwell, I think more than anything, obviously, our understanding of life, death, test, etc. It just gives that light in the darkness. There are many ideas that we have that this is a test, and I've really got to just concentrate on what will bring me nearer to God. A reminder of God's infinite power. I mean, subhanAllah, when you just think about this tiny scrap of RNA causing such complete and utter havoc across the world, and us, all of mankind put together, it's almost like Humpty Dumpty. All the king's horses and all the king's men couldn't put Humpty together again. We're powerless. So it's a reminder for the believer of the power of Allah and how needy we are of the Creator. And I think ideas such as this, and even death, we will all die, we know that, and looking forward to what comes after, it helps the believer to get through these difficulties.
Thank you. If anyone else has any responses to the questions, please jump in. I'll go to the next one. What advice do you have for parents who have never homeschooled?
Bismillah, can you hear me now?
Yeah, much better, yeah.
Okay, so regarding the question about homeschooling and teaching children at home, so we all understand that the online teaching, remote learning is, of course, very challenging. So some tips I would share with parents. First and foremost, I think it's important to establish some sort of daily schedule and routine. Sometimes with children studying at home in a casual environment, they are likely to take things casually and maybe perhaps work in their own time. But it's important that we have some sort of timetable of daily activities. And we, as parents, should know what our child's school timetable is, and we should ensure that they are following it as well. There may be some gaps in the school timetable. Some schools understand that for a child to be in front of the screen for 5 to 6 hours, it's not very healthy. So there are reduced timetables. So if there is a reduced timetable, then as parents, we should try to maybe fill in these gaps. It could be time away from the screen, go for a walk, do some exercise, learn a new skill, maybe cooking, some reading time, whatever it might be. But we should ensure that the timetable for the routine and the schedule is as busy as could be. And also we should take a firm interest in our child's learning. So like I said, know what their timetable is, and we should know what platforms the school is using for remote learning. So some schools are using Google Classroom, some are using Microsoft Teams, Zoom, etc. There's many different websites out there as well. So we should try to come to terms with what platform is being used, and also every school should have a remote learning policy. So read through that policy so that we know what's expected from the school and from the teachers as well. Teachers are working hard. They're making, as well as teaching lessons online, they're doing lots of welfare phone calls to parents and to children. So, communicate with your school as much as you can. And if there are any issues, pick it up with your school. First and foremost, pick it up with the teacher, with your school. And the final piece of advice perhaps is, if it's possible, and I understand it's not going to be possible for everyone, but if it's possible, have your child learn in a public space in the home, maybe in the living area or the sitting room, somewhere like that, because we are getting instances of children logging in and they're just signing in to show that they're present, but they're not actually engaging with the work. So they might be doing something else, they might be playing games, or they might even be sleeping. So try to ensure that your child is in some sort of public area in the home so that you can monitor their engagement. So just to kind of quickly summarize that, some sort of daily schedule of routines, show interest in your child's learning, and monitor to the best of your ability.
How would Islam deal with current day problems like the pandemic? Who would like to take this on? That was a question submitted in advance. Dr.
I wrote about this and gave a khutbah on this some time back. Just some salient points. I mean, if we look to Islam, again, the issue of pandemics or plagues are not unknown in our history. And the Prophet ﷺ, peace be upon him, he spoke about and gave advice on some of these things. So the very simplest advice is essentially don't go into an area which has these sort of diseases, and don't leave that area which has these diseases. So early on in the pandemic, if that had been adhered to, then that would have helped a lot. Other things like separating the ill from the not ill is also an Islamic sort of edict that would have helped also. So this is how, and I think that's one aspect. The other aspects are taking a step back, and it's actually we've mentioned already. It seems that this virus is affecting people who already have various conditions. And so it's really about the general health of our societies. It is very difficult. I mean, I was looking at this whole issue of, for instance, obesity and the massive trends towards obesity. But why is that? It's because of often because of the food that we eat. And you go to your supermarkets and try to find a pack of cereal which doesn't have added sugar to it, then we're not surprised why there's this problem of obesity. So there's a lot more to the picture, and Islam would look at this, not just the pandemic when it happens, but also the whole issue of health and ensuring that people are active, that our diets are better, our air is better, our water is better. All of these sort of things will be looked at by Islam, and it's a duty upon the Islamic State, which would ensure that this is taken as something which is very important. Again, if one of the things that I see is that the value that we seek, government is about looking after people. That's what it should be. It's humanitarian, and Islam makes that very clear that anyone who joins government should be looking after the people. And I think that's one aspect that we can take from Islam if we stand back and look at the bigger picture.
Okay. Next question. Has this pandemic shown the fragility of our societies? Who would like to take this question on?
So can I come back there?
Yeah.
So just to talk about the pandemic itself, COVID doesn't differentiate between any religion or ethnicity.
Yeah.
Every one of us is susceptible to it. So I think that's one key message we need to get across, because I think a lot of the younger people think they're quite immune. I mean, to be honest, I have been dealing, working with our legal team and our police. We've also had like gatherings, because in spite of the advice, they thought, because they're young, they think but what they do is that then they get it, and they may not get ill, but they pass it on to other people. So I think we just need to really realize that we're all susceptible to it. And also, just going on to my Mostafa about obesity and other things, it's also, again, this is what I'm talking about, the short-term impact of COVID and long-term. I mean, the obesity sits within me, and we're really looking at how do we get people to, I know the government that makes national policies, but then it also comes down to us as individuals. So my job is to make sure the right information is out there. You don't have to go and spend thousands of, a lot of money on joining a gym, because in Redbridge, we're a green, there's so many parks, and we need to feel safe. And I think we need to, we've got outdoor gyms in public health. We commissioned lots of outdoor gyms in all the parks. I think going forward, we all need to just reflect and see what we can do ourselves. And of course, we need government policies, and I think we need more funding and all of that. And I take my hat off to my NHS colleagues who really, really work hard, and they see the other side of things. So I think we all need to work really hard together.
Thank you. What have we learned so far about the state of our society during this pandemic? For example, hoarding, selfishness, etc. Who would like to?
I hope it's not toilet rolls.
So yeah, it might be about, it's probably about that. Generally, hoarding in the supermarkets and the organizing the raves. I mean, where I live in Redbridge, just off QnA, about 10 miles down the road, there was a rave in a church for about 200 people, and the police said it was extremely well organized. They even had Visa debit card readers to charge people as they came in during a peak. So what does it say about our society that people still do this despite all of the media around COVID?
I think it's important, if I might jump in here, is just to reframe this entire question from our perspective, which is that much has been made about the youth, and they're not listening to us, etc., etc. And whilst that may be true in some instances, as a whole, I have found that not just the youth, but the whole community has been so incredibly resilient when it's come to the COVID-19 pandemic. I think if you were to go back 2 years and inform people that, oh, by the way, there's going to be several lockdowns and there's going to be a pandemic, we would be a lot more pessimistic as to how people would have coped with what they're having to cope with. So the fact that they've done so well so far, they should be applauded for, and we should motivate them to do even better, rather than always focusing on how people are not listening to what they're being advised to do. And if they're not listening, then we should listen to why they're not listening. Just to kind of bring it back slightly, to the earlier question about what Islam has to offer with regards to the pandemic. I think if people were to, and I think they do understand these points, but if they were to really internalize some of the Islamic concepts about trusting in Allah, which is that, tie your camel and trust in Allah, do your part, not because you think that you're doing your part will change the outcome, but because doing your part is what Allah subhanahu wa ta'ala has asked us to do, and doing it to the best of your ability. Be a member of your community. We are a community. The Prophet Muhammad said that whoever said his community is destroyed, he himself is destroyed. We are not individuals who constantly cast blame on our own community and say, woe to us. Well, we're not those people. We are positive people because we have the hereafter. We're an optimistic community, and we're here to support each other. So trust in Allah, be humble, ask the experts, ask people who know. That's what the Quran says. seek refuge from the devil when he gives whisperings saying that, casting doubts about, certain things which are established. So if people were to internalize some of these principles, they may find it easier to cope with the very difficult situation that they're in. And let's be honest, it's a difficult situation, but so many people have been doing and are doing such a fantastic job. It's not just the healthcare professionals. Everyone from the community has been doing a fantastic job with regards to abiding by the rules, socially distancing, taking up the vaccines, etc., etc. And it's just about motivating them to do even better and to do it for longer, and to let them know that this is not just a short-term thing. We may be in this for the long run. And so it's about giving them the resources that we can to make that long journey. And this is, although this is a new pandemic, just to give a historical aspect, 1840, the Ottoman Caliph, Sultan Abdul Majid, they were dealing with the smallpox pandemic in Turkey and in the Ottoman Empire. And he released a verdict, an edict, not a verdict, but an edict, saying that he will make the smallpox vaccine free for his entire empire, every member of his empire. And then 5 years later, the Sheikh al-Islam of the Ottoman Empire released a fatwa, a religious verdict, saying that he had consulted the Muslim physicians of his time, and he found that the vaccine to be safe and effective, and because smallpox was so devastating towards the community, it was to become obligatory, in his words, and I'm not saying this for the COVID-19 vaccine, I'm not a scholar, but it would become obligatory for the community of the Ottoman Empire. So we are a community dealing with a lot of challenges. We've dealt with many of them excellently so far. We have to continue to do so. But in the grand scheme of things, we are yet another community that's having to deal with a pandemic. Other communities have dealt with pandemics before, and they've done a great job. Let's not let the team down.
Thank you. Okay. I'm going to put all the rest of the questions now. So why have thousands of people not abided by the lockdown rules? Is there an issue of competing values across society? How do we balance Islamic education and school education at home? Is homeschooling recognized by colleges and in any way discriminatory against children than those who attend schools? Do you have a comment on the education minister's comments about complaining to Ofsted about online lessons? If any of the panelists, you can pick which one you'd like to respond to.
So, I'll just pick up the first one.
Yeah.
And then I'm not an expert in schools, except sort of advising on policy. I think I would really go back to Mohammed's perspective, because most people do abide by the lockdown rules. So it's hard for all of us. I've got two sons who live outside London. I haven't seen them since March. So I think we are all suffering. So most people do. So I think it's only a very small minority that do not. And I think we have to understand why as well. So I think that's really, really important, because it's hard for people. So I really would like to say that, we really must applaud the people, majority of people who are abiding by what they need to do.
Thank you. Moulana Farooq, do you have a comment? Yeah.
So I'll come in regarding the question about Islamic education and school education. And it's a very good question. And of course, Islamic education is very important. There's a lot of emphasis sometimes on school education, secular education. And yes, we want our children to do well and obtain good qualifications, go to a good university, get a good job, and give back to society with whatever job they do. But at the same time, we also need to think about their Islamic education. For at the end of the day, the Islamic education, we teach them the basics about who God is, who Allah is. We teach them how to pray, how to do wudu, etc. All of these things are going to carry on for the rest of their life, inshallah. So this is why it's important. So a lot of masjids, a lot of mosques in East London, in Redbridge, do offer a madrasa system. So some of them have an evening madrasa system where you can teach, the child is taught from 5 o'clock to 7 o'clock or something around about that time. Some have weekend madrasas. So I would definitely recommend parents to enroll their children onto madrasa, do your research as to what is being taught, etc. A lot of the madrasas are actually operating remotely and teaching online lessons as well. So we definitely should give consideration to the Islamic side of it. And whatever we can do at home to supplement that, it might just be a time in the family where we sit together and we recite Quran together. It might be a time in the family we sit together and we read a book on Islamic history, or read a hadith book. Everybody takes turns to read. Something as simple as that, just kind of bring that culture of learning and studying and that culture of knowing about the Islamic history and our role models in the home as well. And just one more point as well, a lot of children, they come out of the madrasa system at the age of 12, 13, 14, citing reasons that, you know, they need to focus on their studies, on their GCSEs. This is actually quite a crucial point for them to be actually studying further in the Islamics, because they come across in school a lot of challenging questions about God, about their religion, and they don't know how to answer these questions. So it's important that our children continue to study even when they have come out of the madrasa. And again, a lot of organizations have some sort of study circles, 2-year further Islamic studies, etc. There are many courses out there, courses online as well. So we definitely should do some research and tap into what these organizations are offering.
Thank you. And do you have a response to the question, is homeschooling recognized by colleges and in any way discriminatory against children and those who attend schools?
To be honest, I'm not 100% sure about this question. What I would say is, I would have thought they would be at some sort of disadvantage, because in terms of getting a predicted grade, if they don't have a qualified tutor, then how are they going to get a predicted grade? And also in terms of people writing their reference, these are some disadvantages they may come across. But I'm not 100% sure on the actual, if it's discriminatory, etc.
And do you have a comment on the Education Minister's comments about complaining to Ofsted about online lessons if they're not good enough? I think that she was.
So if parents are having issues and problems with their school, then I think they first and foremost take it up with the school and go through the school hierarchy. So the head of department, the deputy head teacher, even the head teacher. So go through the school hierarchy. Mashallah, schools are doing a good job. And in regards to making comments and complaining to Ofsted, and I would definitely encourage parents to get in contact with Ofsted and to tell the Ofsted about all the fantastic stuff that the schools are doing and the teachers are doing. Yeah.
Thank you. Dr. Riz or Dr. Mohammed, do you have any final comments? I mean, Dr. Riz, do you have a comment on any of the questions? The last few questions.
All I would say with regard to homeschooling is, and kids being at home, just keep an eye on, as parents, just keep an eye on mental health. It is difficult. It's difficult for us. It's difficult for our children, especially older children, teenagers, not being able to go out, not being able to meet their people, their friends. So just think about that carefully. Just be aware of some of those symptoms. Now, I'm getting a lot of calls about some of these things. So go out as much as you can for exercise, etc. Spend some time together, and realize that, look, everyone's going through a difficult time, and we need to cut some slack for our children as well.
Yeah, I think we're at the end now. Okay, so that was the end of all of the questions. I'd like to thank everyone very much for attending today's event, and especially to the panelists for answering all of our questions. Just to end it, I think Amar has got a very short comment to make, and then we'll end, and if Amar can close the event. Amar, are you there?
I am. Can everyone hear me?
Yeah.
Yeah, it's okay. Just wanted to make a quick comment. I think it's really important that we think about humanity as well. And what I mean by this is that, you know, according to recent news reports, in terms of the vaccines that are being distributed, it seems though that the richer nations in the West, they're getting the vaccines, but the poor nations are not. And as a result of that, the poor nations, are losing out. And I think this is purely down to the world order that currently exists in the world at the moment, which is an unfair, unjust world order. And, many academics, such as Hugh Kennedy, for example, who's an academic at Stanford University, he's written extensively on the history of Islam. And he's basically written on how Islam provided a fair system to the world, how it provided justice to the world. And I think, Islam can provide that new world order that the world needs. Islam can provide justice. And I think humanity needs a new world order today that is fair, that is just, and that brings peace and stability to the world. And I believe Islam, can provide that. And like I mentioned, many academics have written on this matter. So, Ghulam, do you want to close the event, or shall I close the event?
Yeah, if you could close the event, then please.
Okay. Again, just want to reiterate Ghulam's points about the fact that I just want to thank all the panelists myself. So many thanks to all the panelists for taking their time out today. Going forward, Redbridge Muslim Parents Association will be arranging more events, inshallah. So watch this space. I know Maghrib is fast approaching. Moulana Farooq, do you want to maybe end with dua, inshallah?
Okay, inshallah, no worries. بسم الله الرحمن الرحيم الحمد لله رب العالمين والصلاة والسلام على سيدنا محمد وعلى آله وأصحابه أجمعين ربنا آتنا في الدنيا حسنة وفي الآخرة حسنة وقنا عذاب النار ربنا ظلمنا أنفسنا وإن لم تغفر لنا وترحمنا لنكونن من الخاسرين. Oh Allah, forgive us for all of our sins. Oh Allah, shower your mercy upon us. Oh Allah, shower your forgiveness upon us. Oh Allah, indeed we are in need of your mercy. Oh Allah, shower your mercy upon us. Oh Allah, help us to come out of this pandemic. Oh Allah, help us to come out of this pandemic. Oh Allah, take away this COVID-19 away from us. Oh Allah, those who have passed away from this pandemic, oh Allah, elevate their status in the hereafter. And oh Allah, those who are ill, oh Allah, grant them shifa, grant them cure. Oh Allah, grant us ease and comfort and protection in all of our matters. ربنا تقبل منا إنك أنت السميع العليم وتب علينا إنك أنت التواب الرحيم وصلى الله تعالى على سيدنا محمد وعلى آله وأصحابه أجمعين برحمتك يا أرحم الراحمين.
Okay, assalamu alaikum, everybody.
Thank you. Bye.
Thank you.
Thanks, Gladys. Thank you. Bye.